Hello, everyone. So, once you have taken an important decision of your life, that is a cataract surgery, the next thing is, are you having adequate knowledge about the cataract surgery? Now, we have lots of information available in internet about cataract. Similarly, you will have friends, relatives who have undergone cataract surgery. They will share their experiences, their knowledge with you. But the problem is that most of these tidbits of information or information which is available on internet is loosely structured. They don't follow a particular pattern for it to become very easy to understand. So the endeavor of this video is to basically give you series of small videos which will give you information right from what's cataract, what are different types of cataract, which cataracts are difficult or dangerous, what preoperative preparation that a person needs to do before cataract surgery, then how to handle fear of cataract surgery. If you are a claustrophobic, how do you deal with claustrophobia during surgery? What exactly happens in the OT? What happens after the cataract surgery? What if you develop complications? What if you have side effects? So all this information is given in a very simple language, which is very easy to comprehend. So I would request you to go through all these videos, and in the end, if you feel that there is something that needs to be cleared from us, you can always get back to us, or uh, you can send a simple WhatsApp message or give us a call regarding any point which you are not able to understand. We'll help you out with that. In case you don't have time to sit through the whole video, we have given links of those small videos in the description box. So our advice would be to click on each of those videos and see them individually at your leisure time. With all this information in hand, you will go very confidently during for your cataract surgery, as well as you will be prepared for any untoward thing if at all it happens after the surgery. And you know that most of the things are very well manageable.
So let's get started and start viewing these videos one by one. So this is how structure of the eyeball looks. As you can see, it's like shaped like a ball. The front portion is more curved and it's called as the cornea. Now this is the transparent part of the eye from where light enters the eye. It passes through an opening called as pupil, and the pupil is regulated by a tissue called as iris. Behind iris, you can see there is a structure called as the lens, which essentially focuses the light onto the retina. Now, the retina is the innermost layer of the eye. In between the retina and the lens, there is an empty cavity, which is called as vitreous cavity. It is filled up with what is called as a vitreous body or a semi-solid structure. Now, the light enters the eye from the cornea, goes to the pupil, goes to the lens, and it focuses on the retina at a point called as fovea. We can also see the nerve coming out of the eye called as optic nerve, which carries our visual signals to the brain. So now when we see the actual photograph of the eye from the front, the white structure that we see is called as sclera, and we can see a central round structure that's called as a pupil. The corner of the eye is given by the structure called as the iris, and behind the pupil there is a lens which is not seen through the naked eye. This is the structure that all of us should know for us to have better understanding of various eye problems. Having understood the normal structure of the eye, let us see how an image is formed in a normal eye. So, when the light enters through the cornea, pupil, and through the lens, it gets converged to a point focus at the fovea. Throughout the pathway of the light, there is no obstruction to the light. As a result, a crystal clear image gets formed as shown here. Now let us see what happens when a patient develops cataract. Cataract is nothing but opacification in the crystalline lens. So as this parallel rays of light enter the eye and comes in contact with the cataractous lens, so instead of forming a point of focus on the retina, this light undergoes internal scattering because of the cataract. As a result of this, the image formation is affected and patient sees very easily, as can be seen in this picture. Hello everyone, my name is Dr. Sagar Bhargav. I'm a cataract, glaucoma and refractive surgeon. In this video, we will be trying to understand an important topic with regard to cataract. Now, when patients go to a doctor and they get diagnosed as cataract, a lot of times doctor will tell you that your cataract has become very hard. He will tell you that your cataract surgery will have higher chance of complication. He will tell you that the cataract that is formed is because of some other issue, or in other words, it's because of some other pathology or secondary causes. Sometimes he will tell you that the cataract will progress very fast, so you need to get operated as soon as possible. Now, on what basis does he tell all these things? Well, the answer is very simple. He's basically speaking about the type of cataract, because each individual type of cataract has individual characteristics, and once we understand what type of cataract a person is suffering from, we can say many things about that particular case. For example, once we know that the type of cataract, we can tell with certainty what will be the rate of progression, how much disturbance it will cause to the vision. Some cataracts can cause problems in early stage itself, whereas some cataracts will cause vision issues only towards the very advanced stage of cataract. Thirdly, certain cataracts are prone to develop complications during surgery. So once you identify these types of cataract beforehand, it will give you chance to prepare yourself better to deal with it during the surgery. Fourth point is that identifying a particular type of cataract will help us in detecting the cause of cataract. And if that cause is still persisting, at least the other eye can be prevented from developing cataract by taking care of this particular cause. Now, before moving on to the types of cataracts, first we try to understand what is cataract. Now, in the eye, there is something called as a lens, which is a biconvex structure present in the front one-third portion of the eye. It allows the light to pass without any obstruction and to converge at a point. Now, when the opacification of this natural lens happens, this is called as cataract, and this will interfere with transmission of the light and formation of image on the retina. When we go into more details, this lens has a covering called as lens capsule, and then there is something called as actual lens matter, which is present within this lens capsule. Lens capsule has got two parts. The front part is called as anterior lens capsule, and the back part is called as posterior lens capsule. And the lens structure is made up of two important components. One is the centralmost zone of the lens, which is called as lens nucleus, and then there is overlying zone, which we call it as lens cortex. This understanding is very important because the type of cataract will depend on point of origin within the lens structure. Now let us see how cataract is classified based on its origin. So if the opacification is in the central nucleus of the lens, it's called as nucleus cataract. If the opacification is in the lens cortex, it's called as cortical cataract. Opacification just before the posterior lens capsule, it's called as posterior subcapsular cataract, and just below the anterior lens capsule, it's called as anterior subcapsular cataract. When we see the lens from the front view, and if there is a opacification exactly in the center of the lens, it's called as polar cataract or anterior polar cataract. Similar opacity on the posterior lens capsule is called as posterior polar cataract. Now, posterior polar cataract has a risk during the surgery because it is sometimes tightly adherent to the posterior capsule. So while removing the cataract, this area of capsule may give way and the lens matter may drop in the back portion of the eye called as vitreous cavity. And then it has to be taken out using a different approach, using a vitrectomy machine by a retina specialist. Now let us look at the type of cataract as classified by your doctor. The first is cortical cataract, one of the common types of cataract. As we discussed, that it starts in the lens cortex and usually starts from periphery of the lens and slowly comes towards the center. Once it comes in the patient's visual axis, it causes symptoms like glare, difficulty in driving, etc. In some cases, it may progress very fast, like in patients with diabetes, uncontrolled diabetes. The photo that you see now shows different grades of cortical cataract. The ones on the right side obviously are very advanced cortical cataract and would need surgery. Next is the nuclear cataract. It's another common type of cataract which arises from lens nucleus. Its characteristic is it's a very slowly progressive type of cataract. As the progression happens, sometimes the minus power of the spectacle keeps on increasing. That's an indirect hint that the cataract is progressing. Surprisingly, in this type of cataract, the vision may not be hampered till a very advanced stage of cataract is achieved. But other point is that in very advanced stage, cataract becomes very hard. Now what we see here is a photograph showing different grades of cataract. As the cataract becomes very dense with time, it becomes brown or black. Now the photos on the extreme right is something that we should avoid in all situations, because harder the cataract, there is a more high risk. There is a higher risk of complications during the surgery. So the circled photo that is seen is the time when it is the best point to operate, not very hard and not very soft. So the decision to operate may at times have to be taken in spite of patient having good vision in order to avoid hard stage of the cataract. Subcapsular cataract, it is also a common form of cataract, and we have seen that it can be anterior or posterior. Posterior subcapsular cataract is more common. Peculiarity about this cataract is that even a minimum amount of cataract can cause significant discomfort and severe symptoms like glare at night and inability to read. In young patients, it may be a side effect of steroid drop use over a long periods, or sometimes consumption of oral steroids for some systemic health condition. The picture here shows different grades of cataract. In general, this type of cataract will need an early intervention because patients are highly symptomatic. Polar cataract. This is a rare type of cataract, and as discussed, it can be anterior or posterior polar cataract. Posterior polar cataract is more common, and it usually presents in third or fourth decade of life. Symptoms are mainly difficulty in seeing in strong light, reading, glare at night. Surgery is planned with special precaution because of the risk of lens matter drop in the back portion of the eye, as we discussed in the earlier part. Now let's look at some special forms of cataract. Rosette cataract or a stellate cataract. It is a rare type of cataract, and it indicates that the patient had past history of injury. As we can see, this cataract looks like a flower, hence the name rosette. Important thing to understand in this type of cataract is that outcome of cataract surgery can be variable, because in this condition there can be association of other issues like glaucoma, retinal or optic nerve damage, which can be as a result of the primary injury. Coming to zonular cataract, it's usually seen in younger children. Now when we talk about lens development, it's a process that continues right during pregnancy and even after birth. So what happens is the lens fibers developed layer by layer. So if during any stage of development any issue happens, that particular layer will become opaque. So the area inside The cataract would be transparent and area outside would be transparent. It can happen because of genetic reasons, or because of vitamin D deficiency, or due to maternal malnutrition. Symptoms can vary from mild vision issues to severe vision problems, and surgery would depend on how much that cataract has affected the vision. Another form of cataract is mature cataract. So this is the end stage of any cataract, and it happens when cataract is neglected for a very long time. So as we can see, it presents like a white spot in the eye, and in this situation patient cannot see anything except for light perception. If this is left untreated, it can give rise to complications like acute pain, redness due to rupture of cataract. While dealing with this type of cataract, intraoperatively there is a higher risk of complications. So it is always advisable that one should not wait for a complete maturity of the cataract. Thus, to sum up, this knowledge will help you to understand what your doctor is planning, thus making things easier to take a decision. In case of any queries, feel free to put questions in the comment box. Thank you so much.
Hello everyone, I'm Dr. Sagar Bhargav. So in this video, we will see patients who have decided to undergo cataract surgery, what all things they should keep in mind before they actually do the procedure. So here is the checklist of the things that everybody should know in their preparation towards cataract surgery. So the first thing that is very critical for your outcome and your mental satisfaction is finalizing the lens type. Now, before we dwell into this, the your surgeon's assessment of your eye is critical. If you have certain diseases like glaucoma or iritis, then the doctor himself will take a call as to which lens is suitable for you. But if you have no ocular conditions or no eye disease, then you have a big say in deciding what type of lens you can avail. And this decision becomes simple if you can figure out which condition suits you the best. So, following are the three conditions that one has to take a call on. So, these conditions include: I want to be free of glasses to the extent possible. I don't mind wearing my glasses for distance. I don't mind wearing my glasses for near. So, the next thing that you should consider is this. Now, I don't want to wear glasses at all, and I can tolerate minor side effects of the lens, and I'm willing to adjust with decrease in quality of vision. In this scenario, the best lens for me would be either trifocal, multifocal, or a ED-off lens. The details of these lenses are covered in my other videos, which is available on YouTube. But if you are not very keen on spectacle independence, also cannot tolerate minor side effects of the IOL, and are not willing to compromise with the quality of vision, then the best lens for you would be monofocal. Now, in monofocal, you would need to understand two more points. How much is your low light activity? And post cataract surgery, what kind of spectacle freedom are you looking at? Is it for near you want to be spectacle free, or for distance you want to be spectacle free? Once you give these two information to your surgeon, he will then take a call as to which monofocal is suitable for you. The different categories includes aspheric, non-aspheric, toric, and non-toric. If you go for the first option, where you are finalize trifocals, multifocals, and EDOF lenses, you would need some additional tests, and these tests include repetition of your biometry, then special study of your cornea called as tomography, and a retinal scan called as OCT. All these tests are required so that the predictability of these lenses can be enhanced to the maximum. Next, we move on to general health assessment. Now, any patient who undergoes cataract surgery has to do some basic tests, for example, standard blood tests like blood sugar levels, hemoglobin, has to undergo an ECG and a physician evaluation. Now, physician evaluation is a very important part of pre-cataract workup, and physician will essentially look into presence of any infection in the body, be it dental infection, throat infection, skin, sinus, etc. And he has to make sure that these infections are treated before the patient is undertaken for cataract surgery. A diabetic patient should have a very good control of blood sugar levels. For cataract surgery, blood sugar levels of less than 200 are acceptable. And a hypertensive patient should obviously have a good blood pressure control because a very high blood pressure on table can have its own problems. And as far as the heart condition is concerned, it should be stable. Now, a lot of people have ongoing oral medications, and common questions that are asked is whether these medications need to be stopped. Now, one of the most common groups of medications are blood thinners like aspirin and clopidogrel. In routine cataract surgeries, the risk of hemorrhage is very, very low. So these blood thinners actually don't have to be stopped. They can continue as routine. But if you have potent blood thinners like warfarin, they need to be stopped preoperatively and substituted by injection heparin. Other oral medications can go on as usual. Now, what do you do if you suffer from claustrophobia? What is claustrophobia? Claustrophobia is a condition where a patient has a fear of closed spaces and patients get a feeling of intense suffocation. Now, in cataract surgery, when we take the patient up for surgery, their eye and face is covered by a drape. So at that point, if the patient is very claustrophobic, he might get an intense feeling of suffocation and will not be really able to continue with the surgery. Now, in this situation, you should inform this point to your surgeon beforehand. The question would then remain is how severe is your claustrophobia? And one of the ways to detect that is to do a dry run or a trial run of surgery and do a simulation of OT preparation in such a way that patients get a good feel as to what will happen during the eye surgery. So if the patient is able to withstand that trial run, then you can very well take up this patient for surgery. But if the patient has acute issues while doing that trial run, then obviously the patient has to be taken under general anesthesia. Now, preparation of general anesthesia is important and a pre-op anesthetic checkup is required. This is done by the anesthetist, and certain investigations may be additionally advised by anesthetist, for example, X-ray chest. And once the date is finalized, when you come for the surgery, you have to be empty stomach for 6 hours and no fluids for 2 hours just before the procedure. Very important point is pre-operative eye drops, which are antibiotic eye drops, should be started 1 day prior to the date of surgery. If you miss that, there is a high chance that the surgery will get cancelled. On the day of surgery, you need to take a normal bath, apply the antibiotic eye drops at least 2 times in the morning. For a female patient, we advise to avoid eye makeup and wearing of ornaments. In case you are using hearing aids, that can be allowed in the OT for a better coordination. Thus, knowing all these points will, before the cataract surgery, not only will lead to better outcomes, but will also reduce chances of complication. I hope this small video sharing with you the things that you should know before undergoing cataract surgery will be of help for people who are planning for undergoing cataract surgery in future. Thank you so much.
In the modern times, we have so many options of IOLs to choose from, be it monofocal, multifocal, trifocal, toric IOLs, extended depth of focus lenses. So, whenever we advise cataract surgery, there is a big confusion in patients' mind as to what lens is suitable for. This video tries to address this issue. Now, this is a decision tree for deciding about what lens is suitable for one side. Let us try to dissect this in small bits and try to make sense out of it. So, first thing that one has to do when one decides about cataract surgery is to understand your own needs. We call it as individual needs. And second is to understand the suitability of the eye for a particular IOL. And that is usually decided by your operating surgeon. In assessing the individual needs, the question that one should ask to oneself is the need for glasses after the cataract surgery. So, if there are two broad categories, one category of patients don't mind wearing glasses. Second category of patients is, if possible, they would like to avoid glasses. So, you need to decide in which category you fit in. So, once a patient has decided that he would like to avoid wearing glasses after the cataract surgery, they can be considered for the special type of lenses called as multifocal IOLs. Before going ahead with these lenses, another important question that the patient has to answer is how important it is for the patient to have absolutely crystal clear quality of vision. If that is the most important criteria, then he will not be a good candidate for multifocal IOL. But some patients who will be able to tolerate minor side effects like halos, glare, and a slight reduction in the quality of vision, they can be considered for multifocal because for them the convenience of not wearing glasses whilst a slight compromise in vision and a mild side effects is acceptable. And for the people who are not able to tolerate these side effects, it's best to go in for a standard monofocal lens, which we'll discuss. Multifocals are further subdivided into bifocals, trifocals, or EDOF lenses. Patients can choose depending on their lifestyle. For example, if someone does mainly a lot of reading, bifocal is suitable for that patient. If someone is into a lot of reading, computer work, mobile, then a trifocal or EDOF lens is good for them. Now let us come to a group which does not mind wearing glasses after the cataract surgery. Now this is the most common group. Almost 99% of the patients opt for this option. And for these patients, monofocal IOL is the lens that we use. Now in monofocal IOL there are two more subtypes. In one type, which is called a standard monofocal, patients will need to wear glasses for both distance and for near vision. Whereas in the other type, which is called as toric IOL, they will need glasses mainly for near, and for distance they will be able to see without glass or with a very small correction. Standard monofocal IOLs are further divided into spherical IOL and aspheric IOL. Aspherical IOL gives a slight better low light vision, so that is useful in patients who do a lot of outdoor activities and especially for patients who do a lot of driving at night. What is the difference between aspheric IOL and a spherical IOL? To understand this, we should remember the structure called as pupil. This is the round structure seen in the eye. Its diameter changes based on the surrounding light. So in very good light conditions like daytime, or in room with good illumination, or in the evenings when you are going outdoors with very good lighting conditions, the pupil size is about 2 to 3 millimeters only. Now if the size is small, rays of the light enter through the central part of the IOL, and these rays converge to a point focus, hence the vision clarity is good. In pitch dark conditions, pupil size increases to 5 to 6 millimeters. As a result of this, rays enter from the periphery of the IOL also. In a spherical IOL, because the curvature of the front surface is uniform, peripheral rays of light bend more as they hit the surface at an angulation. Thus, these rays of light converge more, and hence a point focus is not formed, and patients get a slight blurred image. An aspheric lens or IOL is different in a way the anterior curvature of the IOL is made. Here, the peripheral part of the IOL is less curved compared to the center, so the peripheral rays bend less and point focus is obtained. So also an a good image clarity. To summarize, there are two broad categories of IOL, monofocals and multifocal IOLs, and have further subcategories with many models in them. Each have their own advantages and disadvantages. As your treating surgeon, I will tell you what lens you are eligible for, and then you can take a decision based on the information we discussed. Thank you.
Hello everyone, my name is Dr. Sagar Bhargav. I'm a cataract, glaucoma and refractive surgeon. In this video, I'll be discussing with you the top 10 queries that patients ask whenever we speak to them that you have cataract. So it's more of an informative video, and it will give you some information before you go to your doctor and he diagnoses you with cataract. So what is the first query when you tell the patient that you've got cataract? He will ask you, so doctor, is my cataract mature? Now, mature cataract is a concept which was very much there when there were no advances in cataract surgery. For example, when there was no microscopes or when there was no phacoemulsification system which we routinely use now. So when a patient develops a mature cataract, he'll absolutely see nothing. You will only able to feel light perception. And that's a very, very advanced stage of cataract. So mature cataract, those seen nowadays rarely, but it is still seen. So the next question that the patient will ask is, should I wait for the cataract surgery till my cataract matures? Now 20 years back, my answer would have been yes, you can definitely wait till your cataract matures. But in today's era, that is not the right approach. The approach should be whether my cataract is causing me trouble enough to affect my day-to-day activities. Now that activity will vary from person to person. Like some people are involved in driving, so they will have more difficulties. Some people are involved in computer work, they will have their different level of difficulty. Some people are just leading a very sedentary kind of a life with minimal activities. For them, the level of difficulty may not be much. So the assessment of difficulty with regard to the current stage of cataract is a self decision. If you feel that the cataract is causing difficulty, yes, it's ready for surgery. But if you feel that you are able to manage more than 80% of your activities without much of a problem, you can surely wait. Waiting for maturity to happen is not a wise thing nowadays, because we know that mature cataract comes with its own set of problems. Number one being, the cataract, when it matures, there is a very, very small chance that it may rupture, and that can give rise to an acute glaucomatous attack, a sudden rise in eye pressure, redness, pain. The pain can be very severe that you might have to admit the patient to relieve it. And you have to operate these patients in emergency, and when we operate in emergencies, it's always difficult to get a very good outcome out of it. Second problem with total cataract is, technically it becomes more challenging, because the cataract, once it matures, that means it has become very, very hard. So with the latest technologies that we use, harder cataracts pose a little bit of risk intraoperatively. There is a high risk of complications that can happen. So in today's times, it's not a good idea to wait for the cataract to mature. Only thing you have to see whether the cataract is causing you difficulty. So the third question is also linked to this. What happens if I don't get my cataract surgery at all? There are some patients who also ask this, especially the ones who are in late 70s, early 80s, because they feel that they are able to manage with the other eye. Why should this cataract be done? Well, there are certain tasks which need both eyes to be working. For example, your depth perception needs both eyes to work simultaneously. Number one point. Number two point is that you have a functional eye. Why would you not use it? Just because you don't want to get a surgery done, that's not a right approach at all in today's time. In fact, I would say that age is not the criteria at all. I myself have operated even a gentleman of 102 years of age, and the zeal in that person was as good as a young person. So if there is cataract, it should be out irrespective of what age the patient is, and there's no point in leaving the cataract in place, because just a while ago I did speak about the problems that can happen if you don't operate a cataract, and it can rupture and can cause many complications. Another query that the patients ask is, doctor, will you be doing the cataract surgery by laser? Now, laser cataract surgery has been propagated a lot, but let me be very clear on this, that laser has been made for cataract surgery, can address only three steps for the cataract surgery. What are these three steps? First is creation of the incision, second is creation of a opening in the cataract, and third is softening the cataract. Once you do these three steps, you are taken back to the normal OT, and then the surgery is done by phacoemulsification. Phacoemulsification is a technology which has stood the test of time. It's been more than 2 decades now since it's been in practice and use. It basically uses ultrasound energy to remove the cataract in situ, and the advantage being that the cataract can be removed through that small 2.2 millimeter incision. So laser cataract surgery is a myth. You are only doing few steps with the help of laser. The remaining steps are done by the standard phacoemulsification only. Right. So the next question that is commonly asked is, what is the best lens in the market? Now this is a very common layman query that comes to a doctor. That, doctor, I want the best. Whatever you do, you give me the best lens. Now this is again a thing which is a wrong approach. Every person's eye is different, and what is good for that particular person may not be suitable for another person, and vice versa. So the best approach to this would be to assess your own needs, have a thorough eye assessment, then discuss with your doctor as to what lenses are possible for me in my eyes, and based on your need, a lens selection should be undertaken. So I would put it in this way, that the best lens is the lens that suits you, not the most costliest lens. Okay, so the next question which is commonly asked is, will I need glasses after the cataract surgery? Now, need for glasses basically depends on a choice of intraocular lens that you would do before the cataract surgery. Now, before a cataract surgery, if you choose a multifocal or a trifocal IOL, then the need for wearing glasses after the cataract surgery gets reduced to a significant extent. Having said that, not every eye is fit enough for implanting those kind of lenses. So it's best to discuss with your doctor to see whether your eyes are fit for that particular lens, and will you accept the minor side effects that come along with the advantage of getting rid of glasses. So glasses, the majority of patients basically opt for monofocal lenses, which means that those lenses will correct distance vision, and for reading and near activity, patients will have to use reading glasses. If you would like to know in details as to what are different types of lenses available, what are the different, how do I make that decision, I will just give you a link in the description box, which is a video which nicely explains all that. Now, the next question is, will all my symptoms like eye pain, redness, irritation, and seeing black spots go away after the cataract surgery? Now, this is a very common human tendency. Is when they have an issue, they try to link it with certain other issues which may not be coming out of that particular point. So, for example, the patient may have dryness, dry eye, which the patient thinks is because of the cataract. Or patient may be seeing floaters or black spots, which is basically an issue of a natural age-related change in the vitreous shedding. So these things have absolutely no link to cataract surgery. So even the cataract surgery will only give you clarity of vision, but these symptoms need different kind of management or treatment. So this one has to keep in mind. So the next question is the cataract surgery painful? Will I need injection? Well, in today's time, the cataract surgery is absolutely painless surgery. And the best part is that even the anesthesia does not need any injection. Patient's eyes are basically numbed with the help of eye drops. So it takes about 10 minutes to 15 minutes maximum, and the surgery is completed while patient is absolutely comfortable and even talking. So remove this myth from your eyes. Now I've seen many patients who really postpone their surgeries just because they have this fear of pain and a phobia of operation. Right. So let's see the next question. So what is the incidence of problems and complications after cataract surgery, and what are these issues? This is a very valid question. I think all the patients definitely need to know this before undergoing cataract surgery. Now, cataract surgery is a very safe surgery, and in 99% of cases, really, there is no issue. In 1% of patients, you can have some minor problems or issues like irritation, dryness, foreign body sensation, and discomfort continuing for 3 to 6 months post cataract surgery. And these patients probably would need some additional medications to uh, to to counteract these problems. Their surgeries are absolutely fine. They are seeing very well, but these symptoms can cause a little bit of mental stress to these patients. Major complications that can happen are mainly infection, increase intraocular pressure, and very rarely retinal detachment after cataract surgery. Now, the incidence of these complications are very, very less. And good point is that even if they happen, a timely intervention will make sure that patient does not lose any vision. Let's look at the next question. Can the cataract come back? Now, this is again a very common myth amongst patients. When they see their relatives having a very good vision after surgery and after 2 3 years down the line, their vision becomes hazy. Now, why does this happen? So, first thing to understand is that the cataract, once removed, never comes back. The reason why it never comes back is because in its place there is a lens which is sitting there. We have to remember that this lens sits on a transparent membrane. Now, what can happen over a period of time in about 20 to 30% of patients is that this membrane can get opacified. This opacification is called as this opacity is called as posterior capsular opacification. And if it becomes significant enough to cause visual disturbance to the patient, then a laser treatment can be given to these patients in the OPD itself. And it's a very small, minor procedure lasting for just 5 minutes and totally painless. And the moment you do this, by next day, the patient's vision is back to normal. So these were, in short, the 10 most common queries that I have seen in my practice, and I hope this information is useful to patients who plan for their cataract surgery in future. Thank you.
Now, this video will explain about post-operative eye care that everybody should follow. Starting with medication. Now, most of the eye surgeries will need eye drops. One principle is common to all. It always has to be a single drop application, and you have to close the eye for 30 seconds. Now, in cataract surgery, two most commonly used drops are steroid and an antibiotic eye drop. So, for convenience, we label steroid as drop number one and antibiotic as drop number two. So, drop number one, as you can see, there is a table there which has got time slots. So, this table can be utilized to guide the application for the drop. So, over a period of 4 weeks, the drop has to be used. So, in the first week, it has to be applied 6 times a day according to the time mentioned there. In the second week, it reduces to 4 times a day. In the third week, it reduces to 2 times a day. And in the fourth week, it reduces to 1 time a day. Whereas the drop number two, which is an antibiotic eye drop, has to be applied only in the first week, and it has to be applied 6 times a day. As you can see that the time mentioned for the antibiotic drop is about half an hour later than the steroid, so that it does not interfere with the action of the steroid eye drop. So this is a rough timing, but you can always adjust the timing out according to your convenience. Now, how to instill an eye drop? For this, the attendant, whoever is going to apply the drop, has to wash the hands with soap and water. Hand disinfectant can be applied. Then the patient's head is tilted a little bit, and patient is asked to look up. You may not touch the lower lid in order to apply the drop. A single drop is applied, and the patient is then asked to close the eyes. Now let us look at how to clean the eye. Cleaning should be done once a day, and should be done with the sterile tissue paper. So this is a sterile tissue paper which is pulled out, and the edge with which is going to be cleaned should not be touched with the fingers. So once you apply the drop, little bit of the drop comes out, and with the aid of that drop you can clean the eye comfortably. You need not open the eye for cleaning. You can clean it with the closed eyes also. So idea is to clean the eyelashes and the eyelid margin. Now, how do we apply protective eye shield at night? Daytime, patient is supposed to wear protective glasses. Nighttime, the shield is there, which should be cleaned with a sanitizer or with a liquid soap, and it has to be taped with the help of medicated tape, which is provided, and it has to be vertically applied on the eye, and the tape will keep it attached to the eye. So nighttime, this is how it should be applied. Once patient gets up in the morning, he can go back to his black glasses. Now, certain precautions have to be maintained in the post-op period. Let's look at the list which you should avoid for next 2 weeks. So, headbutt should be avoided. Patient should not rub his eyes. Splashing of water on the face, and driving till a surgeon gives a go-ahead. Playing with small children should be avoided because accidental injury can happen. Straining at stool should be avoided. You can take laxatives for that. Avoid sleeping on the opposite side for at least 3-4 days. Then you should avoid cigarette smoking and alcohol. Avoid having too many visitors at home for fear of contracting infection. Avoid lifting of heavy weights. Avoid going to crowded places. Heavy mobile usage can cause eye strain, so that should be avoided. Office work and public transport preferably should be avoided for 2 weeks. A follow-up schedule will be given to you following the surgery, and in between, if there is any query or any issues, can always contact us over mobile or WhatsApp, so that those issues can be sorted out. In case of development of severe pain, redness, and sudden decrease in vision, you have to report urgently, because that might indicate an infection and it needs to be treated as soon as possible. We wish you a very speedy recovery from the surgery. Thank you. Cataract surgery is one of the safest elective surgery in the human body. In 99% of patients, there are no complications. Patients recover in 3 to 4 weeks completely. In 1% of patients, some complication can still happen, and in some patients, you can have minor side effects. Let's start with minor side effects first. Increased light sensitivity. Before the surgery, the amount of light that enters the eye varies from 0 to 60 to 70% depending on the severity of the cataract. So after the cataract surgery is over, 100% of the light enters the eye, and some patients in the early post-op period are not able to tolerate this. In these patients, they will have to prolong the use of their dark goggles till they become comfortable. Dry eye after cataract surgery is very common complaint. Various symptoms associated with this are feeling of irritation, burning sensation, foreign body sensation, and watering. Symptoms sometimes can be so severe that it may affect visual recovery also. These symptoms cause a significant degree of mental stress to the patient. Answer to this question is that this condition is multifactorial. First reason is that the patient had probably a preclinical stage of dry eye before the surgery itself. It is possible that in this stage that there are no symptoms. After the cataract surgery, dry eye condition deteriorates and symptoms begin to set in. The reasons being the stress of the cataract surgery on the eye surface to the extent that the patient starts questioning about his decision to undergo cataract surgery. Now, why is dry eye so common after the surgery? Reasons can be use of strong light of microscope, creating incision for surgery, use of anesthetic drops and strong antibiotic drops, as also use of post-operative drops which are used in the treatment of cataract. In some patients, there is development of meibomian gland disease, which is a dysfunction of meibomian gland in the eyelid. The treatment of this condition essentially involves regulating the post-op medication, lid hygiene teaching, and appropriate use of tear lubricants, which may be needed for a period of 3 to 6 months. One point should be very clear that cataract surgery is a surgery which is done inside the eye, and this condition is happening over the surface of the eye. So it will be wrong to think that there is a problem in my cataract surgery and that is the reason for all these symptoms. The condition will eventually settle down over a period of time. Fluctuating vision can happen if the wound healing and wound modulation are still continuing. As a result, the glass power frequently changes. These fluctuations usually settles down in 3 months. Negative dysphotopsia is a very unique symptom. Here patients experience an arc-shaped shadow in the temporal field of vision. When clinically examined, these patients have a perfectly normal eye and the lens is very well centered. Dr. Mashkat, a world-renowned researcher in his study, has found that negative dysphotopsia occurred in as many as 15% of the patients early on after the cataract surgery. Although majority improves over time, bringing the incidence down to about 3% at 1 year. He also opined that it can occur in any type of IOL. The cause for this is essentially edge of the IOL and light interaction. Usually most of the patients report improvement with time. One can do simple measures like using a glass with thick temples or side support. This will help in blocking the light from the side and help in relieving the symptoms. Now let us look at some complications. Now these complications can happen during the surgery or after the surgery. Cataract surgery is usually a bloodless surgery. In the rarest of rare events during the surgery, suddenly bleeding can happen from inside the eye. This can happen spontaneously or due to sudden increase in blood pressure. In this event, usually the eye is closed immediately and cataract surgery is stopped. Subsequently, an opinion from retina specialist is sought and treatment is started. If the bleeding is very severe, there is a chance of loss of eyesight. Nucleus drop. This is also a very rare event. It happens more in patients who have difficult cataract, for example, very hard cataract, posterior polar cataract, cataract with loose support called a subluxated cataract. The lens capsule is a very thin membrane around the natural lens. This capsule helps to give the lens its shape. To do the cataract surgery, an opening has to be created from the front side of the membrane, and phacoprobe is inserted through this opening to remove the cataract. But sometimes the back membrane develops a breach, and as a result the cataract falls from the breach inside the eye, and this is called as nucleus drop. In this situation, a retina expert is involved, and retina surgeon creates an opening behind and with the help of a vitrectomy machine remove this drop cataract in the same sitting. Then an implantation is done. Increased inflammation. Like any other surgery, after cataract surgery also human body can throw reaction. In most cases this reaction is mild and gets settled with routine dosage of steroid drops. But if the inflammation is high, as is seen in few rare cases, patient may complain of pain, redness and hazy vision. For treatment, aggressive medication in the form of eye drops and oral tablets are given. Patients also need to be under close follow-up. With treatment, this condition eventually settles down. Infection. This is an extremely rare and dreaded complication of cataract surgery. It can be potentially sight-threatening complication. Patients may complain of pain, redness and hazy vision. Patients should immediately report if these symptoms happen to them. Majority of the infections are treatable if presented early. Treatment is given in the form of eye drop, injection, and sometimes a surgical treatment is also needed. If the infection is severe, there is also a possibility of loss of eyesight permanently. Increased intraocular pressure. This is again a very rare issue. It can happen due to steroids which are needed after the cataract surgery. Treatment is usually in the form of drops and it also settles down with time. Wound leak. Cataract surgery wound is very small, less than 3 millimeters. Very rarely there may be wound leak in the early post-op period. Treatment may be conservative with bandage or patient may have to be taken in the OT and a stitch may be required. Corneal edema. Now cornea is the transparent structure of the eye. In some cases after the cataract surgery, fluid collects in the cornea and this condition is called as corneal edema. This leads to decrease in transparency and decrease in vision. This is usually seen in some cases of dense or hard cataract, or in patients who have inherently weak cornea, or in cases of prolonged surgery due to difficult intraoperative issues. This condition settles down in 8 to 12 weeks. Treatment is in the form of drops and ointments. If no improvement is seen beyond 3 months, then inner layer of the cornea will have to be replaced by a donor tissue in a surgical intervention. This surgery is called as DMEC. Another rare issue that can develop after cataract surgery is PVD, posterior vitreous detachment. This happens because of the vitreous jelly, which is a semi-solid structure in the eye between the lens and the retina, and it starts to contract and starts to separate from the retina from its backside. This can happen anytime after the cataract surgery and patients will see flashes of light and some black spots. Flashes happen because at certain points there is a strong adhesion between the retina and the vitreous. As the vitreous contracts, it is at these points the traction happens and patients get symptoms of flashes. Once the process of detachment completes, that's the time when the flashes settle down. A word of caution in this condition is that during the contraction of the vitreous jelly, sometimes retina may develop a tear which will need retinal laser urgently. Extremely rare event that can happen in this situation is that patient may develop retinal detachment. Coming to retinal detachment. Retina, as we all know, is an innermost layer and is responsible to collect image and transfer to the optic nerve. When the retina separates from its normal position, it is called as retinal detachment. This is a very rare but potentially sight-threatening condition. It happens suddenly and patients may see curtain-like shadow in front of the eyes. This situation needs immediate checkup and surgical intervention. chances of reattachment is very good if surgery is done early. So in conclusion, as we have seen that complications in cataract surgery happen in a very small percentage of patients, and most of these complications, if identified early, are treatable and they don't have any long-term effect on the eye. It's only three complications, that is bleeding in the eye, infection, and retinal detachment, can cause long-term vision issues in a patient's eye. Thank you for your patient hearing.